Good morning. My name is Cristen Bates. I'm the Director of Strategy, Policy, and Communications for the Office of Behavioral Health under the Department of Human Services. And I also love someone in recovery from opiate addiction. My brother's opiate addiction in a lot of ways followed the national trends. When he was a young man, he's what we used to call straight edge. That meant he didn't drink or smoke or have sex, definitely didn't use drugs. He always had some mild social anxiety, but friends, captained a soccer team, got into college, like everything's going great. When he was about 22 in about 2002, when you start to see a very large uptick in the number of prescriptions that are written for drugs like OxyContin, he first tried and was prescribed OxyContin for the first time. And you'll hear a lot of people with opiate addiction have, mild social anxiety and depression, like some mild discomfort. And my brother knew pretty much immediately that this was going to be a problem for him. Over the next 13 years, as you start to see increases in addiction across the United States, my brother's addiction was worse and worse. Took him 9 years, but he finally finished undergrad and, had trouble keeping a job. After my father passed away, he actually started graduate school. Was able to go to the Ansel Adams School of Photography out in San Francisco. So outwardly, things are looking okay, but we all know that his addiction was getting more and more severe. By the time he finished graduate school, things were really bad, and he moved back to St. Louis, where his girlfriend was from, and was evicted for the final time, and he became homeless. When I was a kid, I always thought that homeless people didn't have families. I thought, how could somebody, let their loved one be out there like that? And I never understood when my brother could have come home. He could have come home, but his addiction was so severe, 13 years on OxyContin. And now, like most people who run out of money to use prescription drugs, he was using IV heroin. And I want to talk to you guys about, he's 3.5 years in recovery right now, and I want to talk to you guys about some of the things that worked and some of the things that didn't. So let's just start at the point where he was hospitalized in St. Louis. He was about 135 pounds at 6 foot tall, and he had something called endocarditis, which is a heart infection that you get from IV drug use. He also had meningitis. He also was hallucinating. He almost lost both of his eyes and his leg. He had about a 40% chance of living at this point. And my family flew out every week to beg the nurses to give him the treatment that he needed. One of the things that worked about my brother's treatment is they immediately put him on methadone when he got to the hospital. They put him on methadone for withdrawal management because, one, working with somebody in withdrawal is an absolute nightmare. Anyone in the medical profession will tell you. Not just because they're temperamental and moody and miserable, but also because you can't tell the difference between what is withdrawal symptoms and what is their medical symptoms. I will also tell you that forced abstinence in a hospital leads to a 32% increase in overdose death for people who use drugs. That's either because, that's after 28 days forced abstinence. So what the doctors told us, the first doctor, young doctor, definitely ready for methadone is what this young man needs. Obviously, he's been addicted to opiate for 13 years. Other doctors and nurses would say, well, we need to get him off those medications. We don't do substance use treatment here. And I just couldn't help but think, how is this the only chronic illness you don't treat? How is it that you would come in and treat him for his symptoms? Endocarditis, by the way, if you get it a second time, they will not operate on you. They will not treat you if you've shown that you will continue to use after your first bout of endocarditis. Interestingly enough, physiologically, if you use again, using needles, you will almost definitely get endocarditis again, which puts it on a death sentence, right? And they said, no, we don't provide substance use treatment. So we begged, we flew out, my family, every week, cried with the nurses, told them about what Corey was like, showed him pictures of him as a child, and said, please don't stop helping my brother. After 2 months inpatient, he came out to Colorado. My sister put him on a plane, and I went and picked him up at DIA. And within 3 days, we had him on Medicaid. This is one of the other things that really worked. We got him on Medicaid immediately because he had a location to stay, and he had, and he had been homeless previously. We went to the Arapahoe house. Within 3 days, we were able to get an intake, which was great. intake determined, though, he didn't need residential treatment, which was fine. He had a safe place to stay with the people who don't use drugs. They told us he needed IOP, intensive outpatient treatment, and that was going to be great, but it was going to be 4 to 6 weeks before they could get him in, during which time he's detoxing and withdrawing on my couch. He almost didn't get treatment because he had a pending criminal case in Missouri, and because when they asked him during the intake if he had any pending criminal cases and what the situation was, and he told them because he had a felony possession in Missouri from when he was illegally using drugs, which is what happens when you are addicted to illegal drugs. But that's not why he was here. He wasn't there on court-ordered medication. He wasn't there on court-ordered treatment. He was there because this was one of the things that happened to him that almost killed him. And they told me that they weren't going to accept him. They weren't going to accept his Medicaid because it was court. He had court cases over, they didn't know if this was supposed to be used for court, and they couldn't use it for court. And so I begged and pleaded, and I yelled at the guy for quite a while and explained that you don't understand, you have to help him. He's not here for court-ordered treatment. He's here because he's dying of opiate addiction, and you guys can help him. We can pay for this. He has support. And so they finally agreed to erase the checkbox that they had previously checked that allowed him to enter treatment. During this time, 4 to 6 weeks, 4 to 6 weeks was too long in a lot of ways. I had to watch him all the time. I would take him every other day to see if he could get into the one, slot that they had available for people who were waiting. He wasn't. And access to treatment on demand, I think, is something that's really, really essential here. My brother was motivated. He had a near-death experience. He was, in a safe place. He had family support. He had a way to pay for treatment and still couldn't get in. That's where I feel like there's a lot of challenges. I would also say, lastly, the Lift the Label campaign is about stigma. The reason that he almost didn't get better in the hospital was because the health professionals did not believe that they were there to treat him for opiate addiction. They were there to treat his heart, which they somehow saw as separate, even though it was infected because of IV drug use. When my family was having a really hard time managing his addiction, it was also partially because of the stigma we had. We didn't want to tell people that I had a homeless brother who injected drugs. I'm a health professional. How is anybody going to trust me to do my job if I can't even help my own family? So the Lift the Label campaign is something that I do at the Office of Behavioral Health. It's an anti-stigma campaign. We have a health professionals training that we do, that we do, one for criminal justice professionals, one for health professionals, and one for behavioral health specialists. I encourage all of you guys to go take a look at the videos. My brother and I have one. I cry in that one too. It's very emotional. I'm sorry. Overall, I think there's a lot of really great things that the state of Colorado has to help people who have substance use. I do think we need to do better when it comes to people with criminal justice involvement and allowing them access to treatment and payment for treatment. And I think that we need to do better on how quickly somebody can get into treatment and immediate access as needed. So thank you guys very much for listening to me this morning.
Thank you for sharing your story.
Yeah.
It's really powerful, and thank you for being in the opioid campaign.
Yeah.
It's very brave of you.
Thank you.
That's a lot to reduce stigma.
And my brother's doing super great. He's married. He's got 3 amazing stepchildren. He works at a flea market, which lets him use our degree in really weird ways. And he's very happy. And I really thank Colorado Medicaid for that. But there were a lot of near misses for him. And I hope we can try to find a way to fix them.